If someone collapsed next to you right now, would you know the biggest mistake almost everyone makes? It's stopping to check for a pulse. Many believe searching for a heartbeat is a necessary, cautious first step. In reality, it is a deadly delay. Untrained bystanders cannot reliably find a pulse during an emergency. They often mistake their own racing heartbeat for the victim's, or waste up to 15 critical seconds searching. Every second of delay cuts the chance of neurologically intact survival by 3 to 5%. That is why the American Heart Association and global guidelines completely eliminated the pulse check for laypeople. If an adult is unresponsive and not breathing normally, skip the diagnostic test. Call 911 and start chest compressions immediately. Rapid action keeps oxygen moving to the brain. A sudden collapse is often followed by a sound that tricks well-meaning rescuers into doing nothing: agonal gasping. These irregular heavy snorts are not normal breathing. They are involuntary reflex spasms triggered by the brainstem after the heart stops. This abnormal gasping occurs in up to 55% of sudden cardiac arrests. Mistaking these sounds for safety causes fatal delays as bystanders hesitate, thinking the victim is recovering. International guidelines, including those from the Resuscitation Council UK, state that abnormal gasping must be treated as cardiac arrest. When emergency dispatchers and bystanders identify these gasps correctly, survival rates climb. If an unresponsive person is not breathing normally, trust the rule over the sound and start chest compressions immediately. The belief that CPR requires mouth-to-mouth rescue breaths often prevents people from taking action. In reality, hands-only CPR is the recommended standard for most adult sudden cardiac arrests. When an adult collapses, their blood still contains enough oxygen to sustain vital organs. The immediate need is not more air, but keeping that blood moving to the brain. To do this, place the heel of your hand in the center of the chest and push. Target a depth of 5 to 6 centimeters, pressing at a rate of 100 to 120 compressions per minute. This fast, continuous pressure keeps the body alive without the need for mouth-to-mouth resuscitation. But there is a common misconception about what these chest compressions achieve. CPR does not restart a stopped heart. Instead, it acts as a bridge, manually pumping oxygenated blood to the brain and organs to prevent permanent tissue damage. To restore a normal heart rhythm, a victim usually requires an electrical shock from an automated external defibrillator, AED. As resuscitation specialist Dr. Sarah Miller explains, chest compressions keep the brain alive, but the defibrillator is what restarts the heartbeat. Delivering that shock within 3 to 5 minutes of collapse can raise survival rates to between 50 and 70%. Compressions and defibrillators work together as two parts of a single, continuous survival sequence. But many people hold back during compressions out of a terrifying fear: the feeling of a cracking chest. It is a common outcome, with rib or sternum fractures occurring in about 55% of real-world CPR cases. A broken rib can heal, but a stopped heart cannot. Pushing too lightly fails to generate the blood flow your brain needs to survive, making weak compressions the far greater danger. Legally, you have nothing to fear. Good Samaritan laws across all 50 states protect good faith rescuers from civil liability for these injuries. When someone collapses, imperfect action is always better than perfect hesitation. Subscribe to the channel for more life-saving health guides. When an adult suddenly collapses, survival depends on a direct, uninterrupted response sequence. Recognize the collapse, call emergency services, and immediately begin chest compressions, pushing hard and fast in the center of the chest. Use the nearest AED as soon as it arrives and continue until medical professionals take over. Paramedic John Fletcher notes that immediate bystander action is the single greatest factor in survival. In a real emergency, a 2-minute delay can double the risk of permanent brain damage, whereas starting compressions instantly keeps oxygen flowing to the brain. This guide provides educational guidance, but formal certification training builds the hands-on skills needed to save a life. If someone collapses in front of you, do not hesitate. Act immediately. Armed with truth, your hesitation is gone. In a cardiac emergency, you are the lifeline. Subscribe to learn more life-saving facts.